Welcome. This is MoneyHeart, where we explore the emotional side of money. I'm Camille Diaz, and today we're discussing the cost of cancer. My guest is Tom Walsh. He's a retired elementary public school principal, international volunteer, and father of a pediatric cancer survivor. Tom, welcome to MoneyHeart.
Thank you, Camille. It's wonderful to be invited to be a guest on your show today, and thank you for having me.
You're so welcome. I'm really glad that you're here. Let's jump right in and tell us about your son and your story. What happened there?
Well, as you mentioned, Camille, I'm the father of a pediatric cancer survivor. One of the questions that I get asked the most is, what were the signs and symptoms that led you to believe your son had cancer? I think a lot of times people ask me that because they themselves are worried that maybe their child or their grandchild, could come down with such a thing as cancer at a young age. Mm-hmm. And when my son was 13 years old, we didn't know this, but St. Jude, where he was treated, the neurosurgery team told us that he was actually born with cancer cells stored in his brain at birth. Oh, and wow. So this it was a genetic disease or mutation of DNA that he actually carried when he was born. And when he was 13 years old, these cells began to divide and grow. And when you have a mass growing in your brain, it causes pressure-related issues. And I remember the time we got a call that he fainted at school because of the pressure on the ears from the tumor. And he would complain of headaches and complain of all sorts of pressure-related symptoms, whether it be the optic nerves were swelling, so we had intermittent blurry vision. And like anybody listening, any of your viewers who've had a child that's been ill, you take your child to the doctor, you take them to the optometrist and all these different specialists, but never in your back of your mind do you think this could be cancer.
Right.
Brain cancer, yes.
Right. So that's really interesting to note that it was genetic from birth. So there's nothing you could have done that would have changed this. You didn't mess something up somewhere along the way. This was already happening, and you just kind of had to deal with it as it happened. How did you discover it?
We discovered it, and that's a good point, because my son, the first thing he said when they diagnosed him with cancer is, "What have I done to get this?" And when he later learned that it was a genetic mutation of genes, and what finally led us to the emergency room at St. Francis in Tulsa, Oklahoma, was he became so weak. He had lost a lot of weight because you don't know it. I didn't know it, but we actually use muscles in our forehead to chew food. And when there's enormous amounts of pressure, it's hard to eat, it's hard to swallow. And when he was admitted to the hospital on March the 9th in 2011, they discovered a malignant softball-sized tumor, the size of a softball, attached to the spinal cord, right at the base of the brain, where the spinal cord, right on the brain stem.
So a softball is really big. I mean, to have a softball-sized thing inside of your head, there's not a lot of extra space in there. So that must have really been pressing on a lot of his brain.
Yes, and that's very true. And especially when it's underneath the skull, it was not protruding. And so what happened when they did an emergency surgery to remove it, what we were not prepared for was the effects of the damage that had happened to his brain. Because as you said, there was the cerebellum lobe, that was the lobe closest to where the cancer was found, was damaged. And I remember when he came out of surgery the first time, and he awoke the next day, and the doctor came before dawn and ordered the nurses to put blankets in the windows and darken the room, because he said he would have severe sensitivity to light because the optic nerves were extremely swollen. But I remember he was eating breakfast, and he wasn't able to peel a banana because he had lost that fine motor. That's one of the things the cerebellum lobe controls, is fine motor and balance. And so I peeled the banana for him and I gave it to him. And then when he lifted it towards his ear. He couldn't find his mouth. and all that fine motor and the was gone. And this, and that really, as young parents, really shook us up. It's like, oh my gosh. And I remember the surgeon told us he was young enough. He compared it to the recovery of someone suffering from a stroke. He basically had to learn how to walk again, how to hold a fork again, how to eat again. But he said he was young enough that a different lobe of the brain could learn those skills. But you can only imagine, as a young parent, your child, going from removing a malignant tumor, and this doesn't even get into the treatment of the cancer, but then going to a rehabilitation center to learn the life skills he would need to go through cancer treatment.
So did he have to do some rehabilitation even before you started the next phase of treatment?
Yes, the tumor was removed, I believe he was admitted on March the 9th. The tumor the process of removing it began the next day. But then for 2.5 weeks, he went to a skilled nursing facility here in Tulsa with older adults to learn the life skills of how to eat, he couldn't walk because the balance was all off. Right. And so he was by far the youngest one in the skilled nursing facility. But little things like eating and walking upstairs and walking, all those things had to be relearned because the cerebellum lobe of the brain had been severely damaged due to the cancer.
Yeah. And I think a lot of us don't realize how much we use those skills and how much we just sort of rely on them without thinking about them until all of a sudden we can't do one. And next thing you know, you're like, okay, that's a critical skill. I really like being able to hold a fork, it's a big deal.
Right.
Or walk upstairs and things like that. Having gone through surgery several months ago and having to teach my leg how to walk again. Right. Stairs, still not fun for me. They'll get there though. They'll get there. But it makes you realize, okay, this stuff is a big deal. So when you lose that, especially when you lose it suddenly, it's hard to go and relearn that. And then now he's relearned this and now he's got to go through treatment. What was the rest of the treatment?
Yeah, and I might kind of point out for the viewers, our children, both of them were the all-stars of their little league teams. And that's, in kindergarten, I call it swarm ball. They all swarm after the ball, like in soccer. And there's kids that fall down and others that, turn sideways. And there's always one or two that emerge from the pack with the ball. That was my son, Isaac. And that's what really hit our community and our family so hard. How could cancer happen to someone like that? He was an athlete. He was so talented. He was on the A team on his basketball team. But what really was hard for us is when we found out the diagnosis of cancer and we saw the challenges that just removing the tumor. I guess I was a little naive in thinking, well, cancer treatment couldn't be any worse than this. But when they told us that the tumor was so large and so massive, that the brain damage that was done, they didn't know how much of it could be restored or relearned, the skills that were lost. But to treat the cancer, it would require 8 months of radiation. It wouldn't be radiation every day, but like a week of radiation or radiation 2 days a week. And that would go for 8 months and would leave the brain like a well done burnt steak and literally lower his IQ by 30 points and render him to with massive brain damage and have significant cognitive disabilities. And then they said the chemotherapy would involve 3 drugs and it would cause nerve damage in his legs and cause almost like an MS type of disease where he'd never be able to walk again, and also would cause complete and total hearing loss. Wow. And I remember looking at the doctor at St. Francis and saying, you mean after millions of dollars and 14 months of treatment, the best you can do is giving back my child in a wheelchair, hearing impaired, and no quality of life, right. Massive brain damage. And the doctor said, I've been an oncologist at this hospital for 20 years, and this is the 3rd worst case of cancer we've ever seen. The 3rd worst case. I distinctly remember that, hearing the 3rd worst case of cancer we've ever seen.
Mm-hmm. Yeah, that's definitely something that sticks with you. Really quick, I want to bring up something that you brought up. So you have another son, older or younger?
Younger, 2.5 years younger.
2.5 years younger. So how was he affected by this?
I think when something happens like this in a family, I often tell others, it throws an entire family into a state of chaos and upheaval.
Sure.
Because, for him, he saw all our attention and all our focus going towards his younger brother,
Right.
his older brother, which it had to because of the life critical illness and decisions that had to be made. And not that he regretted that, but it was hard for him to understand. And in his mind, he saw his brother as an athlete, as someone who was extremely talented, just like him. Mm-hmm. And then he worried that he had cancer. And we even thought about getting an MRI to reassure him. But honestly, I don't think that would, he worried for all that time we were away. And I'll get into what happened in Memphis at St. Jude. Mm-hmm. All that time he worried that he had cancer too. If it could happen to my brother, why could this not happen to me?
Right.
And he would say, do I have cancer? I've got a headache. Do I have cancer?
Mm-hmm. Mm-hmm. Wow. I hadn't even thought about that, because siblings so much do that, whatever's happening to one, the other one thinks it's happening to them.
Sure.
Usually it's because they want something that's good to happen to them.
Right.
But in this case, something that was not so great was happening. And he's thinking, well, is it happening to me too? Is it going to happen to me? When I get to the next birthday, am I going to be old enough to have kids? Wow. That's
especially when your kids are old enough to understand how devastating cancer is. Right. And that cancer is not a sore throat. It's not take antibiotics for 2 or 3 weeks, but there's a life and death consequence to cancer. Mm-hmm. And very few people emerge from cancer treatment unscathed, where they don't have disabilities and handicaps. Right. And so for both of them, that was, especially for our younger son, it was heartbreaking to leave him here. Because when we met with that doctor at St. Francis, mm-hmm. she told us, there is another way. And she said, when your son was diagnosed and we did the pathology and saw the type of cancer that he had, we registered it to the Centers for Disease Control, the CDC database, mm-hmm. where all cancer is registered. And St. Jude has a research scientist that combs through there and saw that our son Isaac met the protocols of a research study being done at St. Jude. Oh. And a lot of people don't realize St. Jude is a large hospital. It's a cancer research hospital. So if your child is in an ATV accident with a broken leg, you don't go to St. Jude. Right. You have to meet the protocols of a research study being done on your type of cancer, or they do study some rare blood-borne diseases that are maybe not classified as leukemia, mm-hmm. to get in there. And so we were invited to be a St. Jude patient. We actually signed the consent forms on the 3rd day at St. Francis to be a St. Jude patient while we were there. And when we went to St. Jude, the treatment there it's like the new horizon and the new cutting edge of medicine. Mm-hmm. They were able to do a surgery, and this was really life-altering for Isaac, our son, where most MRIs happen, I'm told, during 2 weeks after surgery. They go back and image and look at the soft tissues. Mm-hmm. St. Jude at the time, and I think it's more prevalent now, but possessed a piece of operating room equipment called an intraoperative MRI, where they could do an MRI in the middle of surgery.
Yes.
And so the surgeon it was a 14-hour surgery. He did 3 MRIs in the middle of surgery, and each time would cut deeper into the spinal tissues and was able to remove all the tumor. And wow. As a result of that, they were able to lower the radiation grade, and he didn't suffer any brain damage as a result of that.
Oh, that's so fabulous. That's a huge, huge thing.
Yeah, it was life-changing for Isaac, right. too, because the side effects of the high-grade radiation were severe brain damage, very, very severe cognitive disabilities. And right. He didn't have any of that as a result of that.
Oh, that's amazing. That's amazing. Because, once you have something like this and there's going to be physical disabilities, it's just so much harder if you also have brain damage to then work through those physical disabilities. So that's, yeah. Now, just in case our listeners don't know, where is St. Jude in relation to where you live?
We live in Tulsa, Oklahoma, and St. Jude is about 400 miles to the east on the border. It's in Tennessee on the border of Arkansas and Tennessee, right on the Mississippi River.
Mhm.
In fact, St. Jude is about half a mile from the Mississippi River, right on I-40. You
Okay.
can literally, from the hotel room there, see the Mississippi River. It's that close. So it was a long ways from home. And his treatment there, we went there for treatment and we were there almost 11 months for treatment. Because in addition to the radiation that he had, and the radiation was considered experimental,
Mhm.
because rather than radiating the brain, the spinal fluid was where the tumor cells were found. They radiated anywhere there was spinal fluid. So all the way from the base of his back, all the way up his neck to his brain received radiation.
Mhm.
And then because the spinal fluid was contaminated with the cancer cells, his bloodstream was not. And they were able to give him some injections and then harvest his own bone marrow to collect stem cells. And what stem cells allow the body to do, and this was fascinating to me, is they could take the same three chemotherapy drugs in Tulsa that were going to be administered, and they could double the dose of those drugs. And the surgeon told us a healthy person like you or I would take 6 months to recover from one dose of that high strength chemotherapy.
Wow.
And in Isaac's case, they would give him these chemotherapy drugs infused through an IV. And then on the 7th day, they would give him back his stem cells to prevent, his major organs from failing and death.
Mhm.
And his body would literally recover to where they could do this again in 26 days.
Wow.
So rather than 6 months to recover, it was less than 1 month, using his own stem cells for the killing off of the cancer.
So really stopping the cancer from coming back, because 26 days is not really enough time for it to get a good hold again.
Right.
Whereas 6 months, if you got to wait that long before you can do another treatment, it might already be gaining a hold by the time you get the next treatment.
Absolutely, yes.
That's just revolutionary. Now,
he had 4 cycles of that too. It was,
Oh, wow.
4 months of that. Yeah.
Wow. So you were there for 11 months. Who was with your other son?
Our other son stayed with his godparents here in the Tulsa area. We live in Sapulpa. He stayed with them.
Mhm.
My son, over the course of the 10 years that he had cancer, he's had 21 surgeries. So there was a lot of surgeries in between. But when he was out of the hospital and maybe outpatient going in for physical therapy, one of us would go home. We try to go home about every 6 weeks and be with our other son to let him know that we're thinking about you. We're still here for you. Because in a lot of ways, you're trying to keep your family together. You have one son that's battling for their life, but you have another son that feels detached, that feels like, why is all your effort and focus on someone else and not me? And I'm hurting too. It's a very delicate balance, especially for any parent or any family going through cancer, to find that balance to meet the needs of all your children.
Sure. Well, yeah, you have children that aren't affected. And so in one way, they're happy that they're not affected, but in another way, they're missing all the attention. So they're going, what do I got to do over here to get somebody to pay attention to me? And I imagine it's stressful on your marriage as well. You and your wife can't have had very much sleep or very much time to talk or think about things. And it's all just medical decisions and dealing with the kids.
Yeah, I tell people all the time, there's no book I've ever read, there's not a step sheet or a YouTube video that prepares you for anything like this.
Right.
You go from you're doing well in life, and then in a matter of 6 weeks, you find yourself in a hospital and you hear 4 words: your child has cancer, and your whole world is turned upside down. And you're exactly right. We would meet a lot of people. It puts an enormous strain on your marriage because you're making life and death decisions that really, it's different, when it's for an older adult, maybe at the end of their life, but when it's a child and you're talking about treatment that could leave them disabled and in a wheelchair and with cognitive disabilities that will last a lifetime, it's very, very difficult for anyone to go through. And especially in marriage, it puts a lot of strain on a marriage.
Right. Do you always kind of have the fear that if we decide the wrong thing, it'll be all my fault, and then my spouse is going to be mad at me because I suggested the wrong treatment? I would be afraid of that.
Yeah, you worry about that. One thing we learned early on is strong communication. Whatever a doctor says to one of us, we share with the other. If one of us was gone,
Mm-hmm,
that we
mm-hmm.
make these decisions together,
Right,
because they're life altering, and they,
right.
even though they involve your child, they do involve your entire family, and you as a family have to live with the decisions that you make.
Yes, definitely. So
Yes.
let's get into a little bit the monetary cost here, because we've got a lot of costs happening, difficulty to your family, what your son's going through, being apart, all these decisions. And I'm guessing treatment isn't always free.
No, I think in a lot of ways I was naive thinking that, because uh, number one, I remember walking down the hallway at school and I said to another teacher, we had a multiple disabilities class at school. And
Hmm.
I really had a real heart for the parents who went through that, because their kids come to school. Some of them were catheterized, some of them wore diapers, they were in wheelchairs. We
Hmm.
had a lot of therapists that work in there. And I said to a teacher one day, I said, I just thank God that my kids are well. I really have a heart and really feel for the parents that grow up with a disabled child, because of the strength that it takes to take care of a child like that.
Right.
And never did I ever think that anything like this would happen to me,
Sure.
where we would go to a hospital and then all of a sudden, decisions are being made and tests are being ordered and surgery being scheduled. You don't really think at that time about the financial cost and weight of what's happening,
Right.
because your initial reaction is, we need to save our child.
Sure.
But
Yeah.
about 3 or 4 days in, when things maybe settle down a little bit, and then you start looking at the cost of treatment.
Hmm.
And I think it was 2 or 3 weeks after being in Tulsa, we were at St. Francis for 3 or 4 days before we signed to be a St. Jude patient,
Hmm.
and joined a clinical trial. But in those 3 or 4 days, we got bills from things that our insurance company refused to pay. And it was tens of thousands of dollars in just 3 or 4 days that were kicked back. And I remember I called about it and they said, well, this wasn't pre-authorized. We only allow this many tests in one day. This isn't a covered benefit. And
Hmm.
I just could not believe it. I thought I had insurance. I mean, I've been paying for insurance all these years. And now when I need it the most, what good
Right.
does it do me?
And they want you to pre-authorize something to figure out how to save your child's life. Oh, wait, stop and make
Yeah.
a phone call and pre-authorize this. That's hard. That's
Yes,
hard. Yeah.
yes,
Hmm.
very hard.
Hmm. So when you got to go to St. Jude, was that part covered?
When I went there, I did not realize, in joining a clinical trial, that all the treatment at St. Jude would be covered, and that, we didn't pay any deductibles. What our insurance didn't pay, we weren't required to pay that.
Hmm.
They do a lot of fundraising. I know they fundraise several $billions a year to cover. St. Jude brings children in from all over the world, not just the United States. They actually have interpreters on staff to work with children. We knew children from China and Puerto Rico and Africa, all over the world. They come here for treatment, and no one has ever given a bill. But I did work with St. Jude to get our insurance company added as a network provider for St. Jude. But I tell people, part of the miracle of St. Jude, over 10 years and 21 surgeries that he had, probably spent over 360 nights in a hospital bed,
Hmm.
that our medical bills were $5 million. And our insurance maybe paid 2 million of that.
Hmm.
And
Yeah.
so 3 million was not covered. And so, as you pointed out, cancer treatment is very, very expensive and lingers on for years. It's not just 2 or 3 months and you're done, but there's subsequent treatments, checkups, other things all the way down the line that happen as well.
Yes, I think that's a really good point, because most people aren't thinking about how much you still have to go get checked, even after you're done with your initial treatment and pronounced cancer free. It's every year go back and recheck and make sure and scan and all of this kind of stuff. That's not just a standard checkup sort of a deal.
When we came home, we would go back every 3 months. And even though St. Jude was not billing us for what was not covered, just a checkup for the MRI and then, spinal fluid analysis and all that would range between $12,000 and $15,000 for a checkup.
Oh my goodness.
And I tell my friends, without St. Jude, we probably would have declared bankruptcy because we were not prepared. I was naive thinking, well, my insurance, I paid this all my life, would take care of this.
Right.
But they don't cover everything. They cover what they determine to be covered benefit for you, not necessarily what the doctor orders and your child needs.
Right. Right. And you're right. They do have that lifetime cap of like 2 million or something. And once you hit it, then they're out. They tap out. They're not going to cover anything after that.
That's right.
15,000 for a follow-up visit. That is a pretty big follow-up visit bill. Plus you're traveling. So you're not at home. So it's not like you're driving 20 minutes down the road. You've got to do this 400 miles away. And I'm guessing you don't go do the appointment, come back the same day. So you need a hotel.
No, and St. Jude would help with the travel costs and give us a place to stay, which was nice. But it was time off work and making arrangements if we both went for other child. But you're right. It's 3 or 4 days, almost a week at a time sometimes, especially in the beginning. There were so many, because it's a research hospital. Part of the research is the effect that it has 3 months out, 6 months out after you're released. So they'd want you go see the spine surgeon to see if there's been any damage to the spine from the radiation. There was all these appointments that took all week long, even dental appointments, because you've had radiation to your brain, and did it affect the gums and things like that in your mouth?
Yeah. A lot of different things to test.
Yeah.
So this was 10 years ago. How are things now?
Things have calmed down now. Isaac's last surgery was 3 years ago. And something happened during the surgery that reminds me, that routine surgery can vary. And this was considered an elective surgery, not necessarily cancer related, but St. Jude did cover the surgery. And it was, when the surgeon cut into the spinal cord to remove the cancer, he nicked a nerve that controlled facial movements on the left side of the face. So if sometimes you see a stroke victim where one side of the face kind of sags and the other side is pulled up. St. Jude did a series of surgeries. One surgery, they actually went and took nerves on the back of his legs all the way up to his knee that worked the pinky toes. And then they came and they grafted those nerves. They went to the paralyzed side of the face and went underneath the nose, the chin, and the mouth to the paralyzed side to give that side some lift and movement.
Wow.
And then there was a final surgery. It was called a smile surgery. It's sometimes called the smile surgery, where they go and they take muscle from your thigh, your inner thigh, and they literally do a microsurgery. It takes anywhere from 12 to 24 hours and a team of surgeons, and they sew blood vessels together and muscle fibers, and they graft that muscle to the paralyzed side of your face to bring full facial movement to your face. And Isaac, when the surgery to remove the tumor, they grade like the facial paralysis on a scale of 1 to 6. And I think he was basically a 1. And after the nerve surgery was done, he was about a 3, and they were hoping to get it up to a 5 or even a little higher with the muscle transplant. But what happened, he went back for an emergency surgery because the muscle started clotting, the transplanted muscle did. And they told us it would be about an hour and a half, and then he would be back. And then the hour and a half came, and 2.5 hours came. And the nurse called and said, the doctor's working, he'll be out to meet with you. And then the nurse, after 7.5 hours, called and said, the doctor needs to meet with you in a consult room. And my first thought was, what has gone wrong?
Right.
And he told us, he came in and he kind of had a tear in his eye. And he said, we gave Isaac a common anti-clotting drug that we give like a car accident victim because he was bleeding so much. And when we did that, Isaac had a massive anaphylactic shock, and he had an allergic reaction to this. And he said, hey, had he not been prepped for surgery with a ventilator tube down his throat and everything that they do prior to surgery, he said we would have lost him in maybe 20 or 30 seconds. Because he said it took them, he said, almost 4 hours to stabilize him, with a crash team running in to revive him before surgery could proceed. And it made me realize, people go in for surgery all the time that seems so routine, but things can go wrong. And there were 3 times during cancer where we almost lost Isaac. And each time you come to that precipice of death and look over that and contemplate loss of your child, and you think about how can you go back into their bedroom and know that they'll never be there again, or tell their younger brother that you're an only child now. Mm-hmm. And I really feel, because I met parents at St. Jude that had to do that. Mm-hmm. I don't know. I can't put into words. How does a parent come to grips with that kind of tragedy in their life?
Right. I don't know. And I hope I never have to figure that out.
Yeah. It's just heartbreaking to even think that.
So do you guys get to do sort of normal stuff now? What's his situation? Did the face get restored? Does he have mobility? How are things working out?
Isaac, he works at Amazon now. And of course, we were worried about nerve damage in his legs, and he walks 15 miles a day.
Oh my gosh, that's far.
Yeah, that's farther than anybody I know.
Yeah.
And he didn't have any brain damage as a result of treatment there. He had some slight hearing loss. He has the hearing of about a 50-year-old man, which, someone my age, pretty good. And there's a lot of sports, any contact sports, he's not able to do that.
Sure.
But he really lives a normal life, like a lot of teens. In terms of the facial functioning, it's still graded as a 3 of 6. Mm-hmm. In a normal position, you don't even notice. But when a spontaneous smile, one side will go up. My dad jokes it's like Casper the Ghost. One side goes up, the other side doesn't move. But it's really something that he's embraced. This is me now. This is who I am, and doesn't really give any thought or worry about it.
Yeah, that's awesome. You mentioned to me about things like family vacations and stuff like that. How did this sort of affect your overall family hangout time and things that you normally do?
That's a great question. My son, I interviewed him, and we talked about that. And he said, I came home. The thing he said is I struggled with, I couldn't go jump on the trampoline like my brother. They used to play football on the trampoline. They go out there and just beat each other up for hours. And they put the dog on the trampoline and jump on top of the dog and everything else. And he couldn't do that anymore. Right. And he couldn't play football with his brother in the yard. And I remember we were home for a few months. He got home in December, and my son younger son, wanted to go skiing. Mm-hmm. And I remember telling Caleb, we can't, Isaac can't do that. And, but we had to look for things to do as a family where one person would not be kind of labeled as disabled or not able to do it because of their limitations and disabilities. Mm-hmm. And so what we did that year is Caleb went skiing with a friend. And then as a family, we took a trip together, and we went to a ball game. We went out of town somewhere and did some stuff together as a family, saw family, went to a baseball game and things like that where we all could go.
Yeah.
Because every family that goes through something like this has to come to a point where you want everyone to feel included, but you don't want to exclude anyone because they're not able to do that. You don't want to go to a ski lodge where one child has to sit all day and watch and not do anything, and the other one goes out and snowboards and gets on a sled and all that. And it's just not fair. You just can't do that.
Yeah, that makes sense. I would have done the same thing. Let's find something we can all do. And in fact, my family, we've talked about doing split vacations because some of us like certain things like amusement parks and rides and stuff like that. And other of us are just kind of like, I don't know about that. And so we've considered breaking up and going in groups, the ones that want to do it and the ones that don't, go do something else that they love so that everybody can have a good time.
Right.
So.
Yeah.
Is there anything you would do differently if you were going to do it over again, or something you would change?
Looking back, one of the hardest things for me was seeing, I didn't know this really looking back 10 years, but I see it now. When I was talking with my son and he came back to school and he didn't want to go to school and I forced him to, and I wrestled with that because he came home and he was bald. He had a large 6-inch scar on the back of his head.
Right.
His face was, he had scars on his face from surgery, and he didn't want to go to school. And then a year or so ago, he told me that, he went back to school and he said, I felt like a stranger in a familiar place. He said, all these kids knew me. We had been, it was a small town there. He went to elementary school with most of these kids.
Right.
And he said, they would stare at me as I walked down the hallway, like I was from outer space. And then he said, they would say hi to me, but it was only because a teacher or a principal told them to. And then he said, I just wanted to die and end it all. And he said the pain was just, and that was heartbreaking for me to hear. And I looking back, I think to myself, what could I have done to prepare him for the emotional cost of trying to fit into a normal society as a disabled child?
Right.
And when he talked about the heartache of wanting to end it all and the stares of people looking at him, and I asked him, well, what got you through it? And he talked about the youth pastor at the church that we went to, and how he had a profound impact on his life, and about how he came to the realization of, he told me a quote from Dr. Seuss, and it slipped my mind, to tell you the truth, but it had to do with, just be yourself. Don't worry about what other people think. I just remembered, you're born to stand out, I believe is what it was. So yes. And it was just a heartbreaking thing to hear, that he wanted to die. And you don't, and especially after everything that he had been through, to come to that point in his life.
Right.
And then to say, I wanted to just end it all and die because I couldn't take the emotional toll it took on his life to fit into a normal society. Right.
Right. And when you're a teenager, that is everything, fitting in with the group. That's kind of where we're at, is like, at all costs, we must fit in with the group when we're a teen. And there's almost no way to fit in if you've had all these surgeries and experiences that are not shared experiences with the rest of the group, because they all have questions or concerns or confusion, or sometimes kids are mean because they're kids, and just the way it is. I definitely see that would be a really hard thing.
I just remember the quote, Camille. It's why fit in when you were born to stand out?
Why fit in when you were born to stand out?
That's kind of his motto now. Why fit in when you were born to stand out?
That's right. I like that. I like that a lot. I think it's a great one.
Yeah.
So you wrote a book about all of this. Tell us a little bit about your book.
Yes, I wrote a book, and I along the journey, my inspiration to write this book, my son and I, Isaac, we were in Washington, D.C. visiting family, and we were at a basketball game, an NBA game, and I was visiting with someone. I had on some St. Jude gear, so we were talking about St. Jude.
Yeah.
He was actually an Air Force colonel at the Pentagon, of all things.
Oh.
And then at halftime, he got up to leave and go somewhere, and then the lady sitting next to him leaned over to me and said, I couldn't help but eavesdrop, but when I saw your son Isaac get up and I saw the 6-inch scar on the back of his head, I realized I had to say something. And she said, my name is Jessica. I'm a 4th grade teacher from Nebraska, and I lost my daughter to the same type of cancer your son had about 6 months ago. And she said, just like Isaac, she was diagnosed at age 13. And she survived 8 years. And then during her junior year in college at the University of Nebraska, died of a secondary tumor that came back as a result of having treatment done. And I realized on that day, I remember giving her a hug and just tears forming in my eyes, that I was not alone in my search to find hope and healing in the carnage of cancer. That there were other people like Jessica, a complete stranger that I met, that was dealing with the loss of her daughter. Mm-hmm. And I felt like if I could write a book and put into words what a family goes through, that I could kind of chronicle the journey of, the diagnosis, the treatment, and then the going home and the survivorship years, that would give hope to the brokenhearted and healing to those whose lives have been upended by really the permanent scars of cancer. They never go away. Mm-hmm. Because for every cancer survivor, there's always a fear that it'll come back.
Right.
Yeah.
Right. Yeah. And you're right that the survivorship journey, I think, is one that people don't consider as much. We all think about the diagnosis part and the treatment part and the hopefully being pronounced cancer-free part, but we don't think about what happens the next year and 5 years after and 10 years after, right, and how that looks and how you're affected and how you need some special equipment or some special accommodations, or you've got scars or something like that that are always with you and aren't going to disappear or change. I think that's a beautiful thing that you've written about.
Well, thank you. And really, too, you have the emotional cost, you have the cost of the family, the finances, and another huge part. Mm-hmm. As you go through life, and the limitations and the handicaps and the disabilities that you have, your entire life is changed by a diagnosis like this. It's never the same. Right. And so by writing a book, I wanted to really appeal to the supporters of St. Jude, to those who are going through a crisis in their life, that there is hope, for the impossible. The title of the book, When Hope Overcame the Impossible, I originally wanted to call it, my son was a huge basketball fan, like an NBA fan. Yeah. And we were actually in Memphis and eating at a restaurant, and he was disappointed that he wanted to go to an NBA game and he couldn't go because his cancer counts, or his blood counts, were too low. Mm. But he actually, believe it or not, at this restaurant got to meet a sports idol. Kevin Durant, at the time, the Oklahoma City Thunder forward, was there, and he got to meet him. And I remember, Kevin Durant saw him, and Isaac, was bald and really kind of gaunt from treatment. Mm-hmm. And I remember Kevin said, "It's not fair. He's only a kid." And I thought, how true. I mean, in the infancy of life, mm-hmm, a child could go through something like this. Yeah. And so I wanted to really highlight, St. Jude and the cancer and the cost that it has, and also the research that's being done to find the cure for cancer. Mm-hmm. Because the team at St. Jude told us that really the cure for cancer is not the right radiation, the right chemotherapy, but like Isaac, he had these cancer cells stored in his brain at birth. And if you can determine what caused those cells to mutate and prevent it from happening, mm-hmm, you can find the ultimate cure for cancer. Right. And really, Kevin Durant's words, "It's not fair. He's only a kid." I think of that for everyone. It's not fair for anyone to go at any age to go through this. Yeah. It's life-changing, life-altering.
Yeah, definitely is. And I think, that's interesting that when he says that, it's so hard on kids, but they're also so amazingly resilient. And
yes,
that's an amazing story that you have shared with us about how resilient he has been. Yes. And not just physically resilient, but mentally resilient, because he's made it through and is doing well. So that's fabulous. Real quick before we end, we included international volunteer in your bio. What are you up to there?
I love to travel. 2 years ago, I have a group of guys that, they were retired, principals, and one's a dentist. And we took trips to Honduras and El Salvador and Costa Rica. One of the guys was a Vietnam veteran, and we'd always had plans to go to Vietnam. And 2 years ago, they all backed out. They were older than me. And so I went anyway, and went to Hanoi and stayed in the Airbnb with an English-speaking family. And I really have a love for international travel. And my sister, I've been to El Salvador. She had sponsored an orphanage in El Salvador for years. Mm. And I told her 3 years ago, I said, well, let's go down there and meet him. And so we went down to El Salvador and went to this orphanage and school, and really just fell in love with the kids there. And what was heartbreaking for me, and I thought of my son and what he went through with cancer. Some of these kids, there was about 50 kids in the orphanage, and maybe half of them didn't have any parents at all. And some of them were found homeless at like 4, 5, 6 years old, wandering the streets of San Salvador. And there were others that were older that had parents, maybe, 9 or 10, but were the victims of human trafficking, had been trafficked by their parents into gangs, into, prostitution and other things. And it was just so heartbreaking that these kids maybe aren't going through cancer, but the toll that, human trafficking can take on a child's life, and the problems that it leaves them with as young adults growing up. I really just fell in love with going there and helping those kids. I'm planning a return trip in August for 2.5 weeks. I love going back, having retired as a principal, going back and working in a school and being an English teacher and being a teacher and helping out with duties at the school and being around those kids. It's really fulfilling and really something that really brings out, your compassion and love for others when you see someone in so much worse off than you are.
I love that message of continuing to give back. That's
yes.
Fabulous. Yes.
Thank you.
Thank you so much for joining me today. Really
well, thank you, Camille. I've enjoyed being here. So
yeah. Thank you as well to our listeners and viewers. Tom can be reached through his website, www.thomasmwalsh.com, or via Facebook Messenger and Instagram at author Thomas Walsh. His book, When Hope Overcame the Impossible, is available on Barnes & Noble, Amazon, or through his website, thomasmwalsh.com, if you want a signed author copy. Thank you as well to our listeners and viewers. I'm your host, Camille Diaz. I specialize in financial education, life insurance with living benefits, and guaranteed lifetime income. You can contact me and find out what else I'm up to through my website, CamilleDiaz.com, and follow me on social media at Cam Unfiltered. Be sure to follow MoneyHeart at MoneyHeart Show and on our website, MoneyHeartShow.com. Tom's provided us with a money mantra, and then he's going to tell us why he chose this one. So today's money mantra is, money cannot buy happiness, but somehow it is more comfortable to cry in a Mercedes-Benz than on a bicycle. I love that. What caused you to choose that?
Camille, I was in my early 40s when our family went through this crisis with my son, Isaac. And I was a principal. My wife was a teacher. We had very good medical insurance, but we were not prepared for the unforeseen tragedies of life, like cancer, like a disability, like a loss of work income, having to take off to take care of a loved one for an extended period of time. And so I look at that as, you can go into something like this better prepared. You can have a cancer policy that pays for a lot of things that the insurance company rejects.
Right.
You can have policies when you have to take almost a year leave from your job where you're paid. You don't have to, because the bills still keep coming. There's mortgage to be paid. There's car payments to make. There's, utility bills to be paid, credit cards to be paid. You can go through that and cry in a Mercedes, so to speak, rather than cry on a bicycle where you have very little support around you. Whereas when you money matters, you want to go into something like this where you're prepared, I call it the unforeseen tragedies of life, where you're better prepared and able to deal with that financially.
Yeah. You're absolutely right. Thank you for bringing that up. And that is exactly why I'm so passionate about life insurance with living benefits, because it lets you pull that death benefit early and use it in a situation like this, and use it for anything you need to use it for. So if you've got to keep the mortgage going and the car payments and all that stuff happening, even though you're not at your house, they still expect you to pay the mortgage. Even if you're staying 400 miles away for treatment, they're like, no, you should still send in your mortgage payment. So I love that. Yeah. Living benefits is a fabulous thing. And you're so right. Getting set up ahead of time is the way to go, because when this happens, it's too late to put something in place. You can't do that. And I've had a couple of friends recently diagnosed with cancer, and just really felt for them because they did not have something in place. Even though they knew it was an option, they chose not to do it. And I'm waiting to see how that turns out. Hopefully, well, I'm wishing them all the best, but I would much rather be handing them a living benefits check than just, wishing them well and trying to
Absolutely.
help out. So yeah, thank
I
you.
wish I'd heard that message prior to my son being diagnosed with cancer.
Yes.
When we got back, we took out all those policies on our other child and on ourselves.
Okay.
Isaac, of course, wasn't able to be covered under that policy right away.
Right.
But I realized after going through that, the value of that and being prepared.
Mm-hmm. Yeah.
You want to cry in the Mercedes and not on the bicycle.
That's right. I would much rather cry in a Mercedes, especially if you can get the tinted windows so that everyone else can't look at you.
That's right. That's exactly right.
Yes.
Very, very private.
Very private. Very private. Yes. Thank you, Tom. Really appreciate you being on the show today.
Thank you, Camille. Thank you for having me.